And Dr. Gilkey, the floor is all yours.
Great. Thank you so much, Shireen. I appreciate that and that introduction to this session. I want to welcome everyone here tonight on this snowy night. It's really very nice to be able to do this online, and we can spend the time and really dig into what our program is about, as well as our admissions process. So anyway, welcome everyone. Okay, next slide. Great. Okay, so as an introduction, we are the PA program for the University of Michigan. We are located at the University of Michigan-Flint campus for all of our didactic phase. We do have clinical immersions, meaning that you get to go out on sort of mini clinicals during that time, but all of our coursework and everything is on the Flint campus. To give you a little bit of history about us, we started our first cohort in January of 2021 and graduated our first cohort in May, or actually April of 2023. So since that time, we've had 2 graduating classes, and we have another class, the class of 2025, sort of on the launching pad, getting them ready for this April and graduation for them. So we start our cohorts in January during nice winter weather, and we go for 28 months. Our program is a 28-month program, so we graduate in over 2 years in April of that year. We have 50 students per each cohort, so it's a good size class. And just to give you sort of a frame of reference, we are part of the College of Health Science at the University of Michigan-Flint. So we're joined by OT and PT and nurse anesthesia and public health, all within our college. So I know you all want to know, first things first here, how much does it cost? So our current year cost are, if you're an in-state student, a tuition and most of your fees are $116,000. And you have to know, when comparing programs, I just want to be able to say this, you need to look at the base tuition, but you also need to look at fees. And for us, we roll the fees right in for the most part, other than an orientation fee that you'll have, and there's a fee, a cadaver fee, that you would pay for your courses. Otherwise, most of the costs of attendance are rolled into this. But there are some other fees that you need to be aware of as well, and we do have those on our website. And so it's important for you to know that you would be buying your equipment, you would be, paying for your health insurance and other maintenance things that are required for the program. So I urge you to take a look at our website, take a look at the listing of the cost that are there, but our base tuition is that. Now, if you're an out-of-state student, it's 50% more, and as it currently stands right now, and that would be at $177,000 approximately. Okay, so just keep that in mind, but also when you're comparison shopping, make sure that you look at program fees as well, because sometimes you'll see an artificially low cost, but that's just tuition. It's not all of the fees that are associated or the other requirements as well. So, great. So it's really important when you think about the University of Michigan, and the University of Michigan-Flint PA program is our mission. This is our stopping, this is our beginning, this is our end. Everything revolves around our mission. And our mission is to prepare students to become exemplary PA practitioners, leaders, and advocates for the profession and in public health. So everything revolves around that. If you make it to the interview, you're going to be asked about the mission. If you are in the program, we talk about the mission. Our entire curriculum is built around this mission. Our hiring of our faculty and staff is around our mission. So it's really important that you understand that we actually choose our students around our mission. And we're going to talk about what that means in detail as we go along. So it's important that you know right from the beginning about our accreditation status. A couple of years ago, we had a interim review, as all new programs do. There's a three-step process for new programs. So as I just mentioned, that we started our first cohort in 2021. We graduated our first cohort in 2023. So we had had a visit prior to the start of our program. We had another visit right around the time of graduation of our students. And then now we are due for a third visit. And that is all in the provisional accreditation standards. So the first visit that we had, we were awarded a provisional accreditation. At our second visit, we were awarded provisional accreditation, but with probation. And so that meant that there were things that we needed to work on over the couple of years. So here we are, 2025, and next month we are facing our third and hopefully final provisional accreditation visit. And then we will find out from the commission, our PA commission, and after their meeting in June 2025, what our status is. We take this very seriously. ARC-PA is an organization that looks out for students and, of course, programs, but also our patients. Everything is built around safety for our patients. And so ARC-PA has requested that there were a number of areas that we needed to address, which we have. And we're looking forward to our site visit to be able to show them the progress that we have made in those areas. So during their probation status, we were not held to change our program in terms of how many students that we enroll. So we have continued to enroll our maximum students. But like I said, we are working very avidly to make sure that we are in full compliance with all of the standards going forward. So. Okay, in talking about our program, as I mentioned before, our program is 28 months in duration. We are in two phases. We have a didactic phase, which means classroom phase, and clinical phase, which is 11 months, but then there's also another month that is tacked on there. So it is for our summative evaluation and testing at the end of the program. So the first 16 months are the classroom, where you have a regular schedule every single semester of classes, which are lecture and laboratory, and what I had mentioned was clinical immersions. And that is a really wonderful time where it's set up where you are paired with a clinician at a clinical site, where you get to go and you get to practice your history and physical exam and actually work with a clinician to see patients. And it's a wonderful, very affirming time for you to be able to get out there and to get some practice before you actually start in the clinical phase. So the clinical phase, like I said, is 11 months, and you cycle through a series of 4-week rotations for those. So those clinical rotations will take place in various areas, but first let's talk about the didactic phase. So that's 16 months in the first 4 semesters. And during that time, you have a 4-semester clinical medicine sequence where you learn the nuts and bolts of medicine. Then you learn how to do a history and physical examination, how to formulate a differential diagnosis, and really all of the hands-on parts of practicing medicine. And that is in our patient evaluation, which is a 4-semester course as well. Clinical medicine, patient evaluation, you hear a lot about because, like I said, it gives you the knowledge and the skill in order to be able to practice medicine and get you ready for your clinical rotations. Then you have a 3-semester professional issues course, which actually I lead right now. And that is all of the topics that are important to medicine, but not the actual practice of medicine. So we learn about ethics, we learn about interprofessional communication, we learn about religion and learn about legal issues. We run through a whole 3-semester. Cultural humility, we talk about. We talk about social determinants of health, all of those things that are so important for you to learn. Then the first semester, you have an anatomy course and a fundamentals of disease course to get you ready and actually give you the fundamentals while you're learning the first semester of clinical medicine and patient evaluation. And then finally, in your 4th semester, we cover public health and research and epidemiology. Very important for you. And again, remember, we talked about our mission. This totally goes with our mission so that you're prepped and ready to go for your clinical rotations. So after you have these classes, at the very end, you get training in BLS, and it's great if you're coming in with that, and ACLS, so Advanced Cardiac Life Support. And so you get trained in those areas. Then we have the MAT training as well that you're provided with so that you can go and apply the skills in your clinical rotations. And then procedure-based curriculum. So we make sure that you have the skills that you need, the suturing and injections and other things, so that you're prepped and ready to go. And the MAT training, in case you're wondering, that's medication-assisted training. So that is the opioid use and training that you'll get before you go. So let's move on to clinical rotations, which is, it's actually a very wonderful part of our program. So there are 6 4-week rotation experiences that you'll have. So each one, again, is 1 month basically. Pediatrics, women's health, surgery, behavioral medicine, emergency medicine, and geriatrics. So those are very standard. But then there's 2 areas, family medicine and internal medicine, where you have 2 8-week experiences. So the way that these go is that you're prepped and ready to go for the, let's say, pediatrics. So you're communicating with a pediatrician and you're at a pediatric site. And so you'll spend 4 weeks there learning hands-on, learning the knowledge and gaining medical knowledge and the skills and the critical thinking skills and the hands-on skills in pediatrics. And at the end of that time, you take an exam. And if it's a certain rotation, there may be some assignments that you do, but it's all hands-on learning at that point. So you practice your history and physical examination. You learn how to do a differential diagnosis, coming up with the things that are most likely going on with your patient. You'll be presenting to your preceptor. You'll be interacting with a clinical team. All of those kinds of things that you will see as a PA and experience. So this gives you a very nice, sort of well-rounded clinical experience. So before we move on, are there any questions that anyone has about the program? We certainly can entertain those at the end as well. Any burning questions about anything?
Hi, I have a quick question.
Sure.
For clinical rotations, do you guys give any offers like for the students to choose others that other than the ones that are required?
Well, we do have an elective rotation. So during that elective, we make every attempt that we can to link you with the clinical rotation that you in the area that you would like to. We can't always do that depending on availability and the time that your elective comes in your schedule, but we do make every attempt to do that. Otherwise, though, our curriculum is set. So we know that you have to do 2 months of internal medicine, 2 months of family med, and 1 month of the others.
Okay, thank you.
Sure. Okay,
Hi.
another question? Yep.
Oh, I had one regarding, I receive emails regularly regarding UM-Flint's neuroscience updates and research that they're being performed at the college. And I was wondering why that wasn't included in any of the rotations.
I'm not sure who those emails are coming from. Who is that coming from?
It's the University of Flint, Michigan.
Okay, it's not coming from the PA program though, right?
Oh, it must be the rehabilitation program.
Yes, I think you're right. Okay,
Okay.
I just wanted to clarify that because I'm sorry, we haven't been putting those out, so it didn't sound familiar.
Okay. Thank you very much.
Okay, thank you. Okay. Yes, next.
Sorry, I have a quick question. So bouncing off of his question, is there an opportunity to mix the PA with like research during your clinical rotations?
You know, I'd like to say yes. However, your schedule varies from rotation to rotation, and you're working more than full time because you're at the clinic full time, and you have to come home and study. So the thought that you would be able to do research at the same time, I think you'd almost have to be superhuman in order to do that. And especially, you know, it depends on what kind of research you're talking about. But for the most part, I would say during that time, your time is limited. If you're going to be doing research or anything, it may be during the didactic phase, and it depends on how well you're doing academically and knowing that your academics come first. Okay, we'll take one more question, then we'll move on to admissions. Next.
I was gonna say there's 2 questions in the chat if you want to read an answer.
Well, I can't see the chat right now, and I think Shireen will be doing that. And we're certainly going to cover as many questions as we can at the end. So if there's one more question about this, and then we can move on.
Hey,
Yeah.
I had a question really quickly regarding tuition and fees costs.
Yes.
So some programs do offer like out-of-state students to get their residency in the state that they reside in, and then that will alter their tuition rates. And I was just wondering if that's something that you guys offer as well.
You know, I'm not aware of that. Maybe Shireen does. I don't know.
Yes, there is an opportunity for out-of-state students to request their residency status to be changed once you are admitted or you receive an official admittance letter from the program. Then you can work with the Office of Residency on the Ann Arbor campus. So yes, there's an opportunity for you to do that.
Thank you.
Thanks so much, Shireen. Appreciate that. Okay, so we're going to move on, and like I said, we'll get all your questions answered. But I thought it would be very nice sort of to break up the talk. So, okay, so we're going to talk about admissions now. What does it take, and what does the process look like? So we have a holistic admissions process, and when we say that, what we are talking about is that we really look at all aspects of your record. And so we look at your academic progress and we look at your non-academic accomplishments. So that's really very important to us. And we take into account both of those. And I'll tell you exactly how we do that. And the reason why we have this holistic admissions process is because we think that it is really important to have individuals that have various attributes. And we have listed those attributes on our website, and we're going to be talking about those. But those attributes that are listed on the website are actually used and woven through our process and actually mapped to different parts of the process that I will outline for you. Okay. So we have actually a five-step process that your application undergoes review. So the first step in the process is that we review your application to make sure that you have met the minimum requirements. Those minimum requirements are all listed on our website. That's your cumulative GPA, making sure it's at least a 3.0, your prerequisite GPA, your prerequisites are that we have all listed, and they're also in your CASPA application because you have to put those in. That they're a grade C or better, that you will have completed your undergraduate degree by the time you start your master's program. Obviously, that's a given, right? So even if you graduate in December, you have to graduate in December in order to start the master's because you have to have that undergraduate degree completed. That you have taken the correct prerequisite courses. So a review is done that you've taken the correct course at correct level. Then we take a look to make sure that you have completed the Casper test. We don't have a cut score for that. We just want to see how you did. We also look to make sure that you have 500 hours of hands-on healthcare experience within the 2 years prior to the time of that you would be admitted to the program or submission of the application. We look to make sure that you have signed off on the technical standards, and those are the things that are so important that you must possess in order to be in our program, because you need those in order to be successful. So there would be no reason that we would, necessarily want to put somebody in the position of having to perform the hands-on skills and the being able to handle the medical knowledge that we would be imparting during that time. So that's why technical standards are so important. Then we would be taking a look at making sure that you've met all the minimum requirements for admission. But then we also take a look and see, are you a U of M-Flint student? And in public health and health sciences on the pre-PA track, or in the RT program, or are you a student in the College of Innovation and Technology, their human biology program? Those students, as long as they meet the minimum requirements, get an automatic interview. So it's really sort of a perk to be a U of M student. So that's really kind of a nice thing. Then we take a look at your application and make sure that you completed. There's a couple of extra questions that we've added. And in the past, we had a question about integrity and ethics, and another one regarding leadership and advocacy. And again, all of these things are mapped to all of those attributes. So the idea is somewhere in the application process or our interview that we have hit most of those areas to be able to assess, where do you fall on that spectrum? Are you really transformative in that area or above average? Or do you meet the minimum or that requirement? Or maybe, that's not an area of strength for you. So those are the things that you're being evaluated on. After we determine that you meet the minimum requirement, then we sort of go to step 2, and that's a review of your CASPA application. And we look at it in 2 ways. So the first thing that we look at is we do look at your academic record. And so that's really important. Obviously, you need to be a strong student, no question about it. The PA program is very rigorous, and so being able to take a look at that is important. Well, what things do we look at when we look at your academic record? Well, again, we look at your GPAs, and you get scores for those, both the prerequisite as well as your overall. We also take a look at your last 60 credit hours, undergraduate hours. The reason why that's important is because we'd like to see, even if you had some difficulty in the beginning of your undergraduate career, we understand that. But we really do hope that the last 60 credit hours really reflect it's higher level courses. You're used to college at that point, and we hope that to be able to see an upward trend, and that you've done well in your last 60 credit hours. Or if you had difficulty in your undergraduate year, but you took more undergraduate courses, we take a look and see what those last 60 credit hours look like. Because some people struggle, in their undergraduate, but they decide, now I'm ready. I'm really going to commit myself. I'm going to go ahead and take more classes. And then we take a look at that. And sometimes it's a matter of time. So that's what we look at. Then we look at your undergraduate science GPA and being able to see what that looks like. And obviously, the higher the GPA, the better. We look to see, if there's been a grade decrease over time. Have your grades tended to increase, or did you do really well initially, but then really dropped off in the higher level courses? That would be important for us to know. Our program is very rigorous, and we want to ensure if we admit you that you're going to graduate. And so that's where that becomes very important. Then we take a look at your prerequisites. And did you fail a prerequisite 2 or more times? If you did, that may be something where you need to think very carefully about when you're taking classes. We do understand if you took a class and you needed to repeat it in order to increase your grade and understanding in that. But if you had to take it several times, that's difficult because, again, that can signal that you're having difficulty, especially if it's in basic sciences, because you may struggle with our curriculum. Then we take a look and see, did you take a full course load? Like I said, 100 times now. It's a very rigorous program, and we really want to make sure that you're going to be able to carry a full load. It's a lot of hours, and you need to be able to juggle a lot of things at one time. So if you've taken a full course load. Now, I also have to say, you may have been taking maybe close to a full course load or more classes at a time, but maybe you were working full time during that as well. So we do take a look at that. But a full course load really gives us the best sort of window in terms of how you may be doing with that. Then we look to see, if you've been engaged in academic activities within the last 2 years, or was it remote that you were in school and then now you're applying for a graduate program, but you've been out of school for a while. And again, none of these in and of itself is something that is going to make or break you, but we take a look at all of these things when we evaluate your record. And then again, were you enrolled in full course load? We just want to make sure that you're able to handle course load. Okay. So those are the things that we look at, and those are the things that would be scored, and then you would receive a score for that component. So then we move on to that. We take a look at that, and then our admissions committee then gets together, and then we take a look at the highest scoring folks, and that's where we come up with our decision to interview. So if you did really well, in your grades, and you scored well in the attributes, and then those are the things that we would be looking at for an interview. So I just realized that I did not talk about the review of the non-academic parts of your record. And so as you can guess, what I'm going to say is that those attributes that are on our website, those are the things that we look at for each of you through your CASPA application. And we look to see how well was it expressed that you showed us that there were maybe some acts of service or altruism or advocacy. Were we able to read and understand your CASPA application? Did you communicate clearly and concisely and effectively? Did you, were you able to be showing us how your critical thinking came into play, and how well you were able to show us your creation and discover your critical thinking? How well your desire to learn, your dedication to practice as a PA? Were you did you join MAPA or APA? All of those kinds of things that would really help you understand. Did you shadow PAs? those kinds of things. So we actually see the behaviors that are and the outcomes that would demonstrate your these attributes to us. Okay. And then we could just go down the line in terms of, you know, teamwork. Did you demonstrate evidence of teamwork or interpersonal skills? And so we glean that from different parts of your application. Did you display leadership or leadership potential? Did you work with some underserved communities, or did you work in an underserved area in terms of medical specialty? And, you know, is there a desire perhaps to work in those areas later on? Did you work with diverse populations? And did you, you know, all of those kinds of things, basically. So I've just sort of rattled off that list. But those are things and different things that we actually look at and, you know, provide some scoring on your application for those things as well. Now, we get asked, do I have to score high in all of those areas? Absolutely not. I mean, we're all human. We're just looking to see where you fit in that. And so it gives us a better idea. This is part of our holistic review. Okay. So then we put all of that information together and we look to see the highest scores, and then that's how we decide the decision to interview. And so we bring you in, and during that time for the interview, and in our decision for the interview is, you know, how well do you support our program mission? Is there potential for success in this program? And are there any academic concerns? So those are really the things that we're looking at. And those are things that you can even assess yourself or have someone take a look at your file and be able to help you with as you're going through this process. Then when you come in, if you're invited for an interview, you, at least the way that our interview structure is right now, we have 2 interviews. We have one with a faculty and one with a community PA. These are structured interviews where there's a set question list and every applicant is asked those questions. So it's important to know that if you are invited for an interview, it's probably in your best interest not to share those questions, because others may be coming and have very similar questions, perhaps. Maybe not the same question, but something that would really get at certain attributes. So you may or may not want to share that, because it may give someone a head up and, you know, give them an unfair advantage that you didn't have when you come in for the interview. So our questions are structured around those attributes and getting at those and sort of tying those with, you know, what your thoughts are, where you're at, what you've done, and where you want to go with your education and what you want to see as a PA and what you would like to do. So that's really important. Another thing that we have you do is we have you write when you come in. So we have some writing prompts where we have you sit down and we give you a prompt and you handwrite your response for us. And we also take a look at that and score those according to a rubric. And the whole idea is that we want to see, number one, your original thought and how well you critically think on the spot. Critical thinking is really important, and that's the reason why we have our interviews. We want to see maybe what a patient might see with you as a practitioner. So it's really important we have in-person interviews, because we believe that that is very important for not only what we might see in the classroom, but also what your patient might see eventually. So that's our rationale for that. And then, of course, we have a question and answer session at the end of that. Then all of that information is brought together and we do a global review of all your academics and all of those attributes, everything from seeing the academic excellence all the way to your future potential to serve in different areas and populations and specialties, and your leadership and your life experience, your resilience and adaptability. So all of those things are looked at. And then finally, there's final determination spreadsheet, and we look to see, and it's based on the highest ranked students as we go through. Okay, so I know that that was laid out, but I just wanted you to understand how we use those attributes and your academic record in our selection of students. Okay, so our faculty and community PAs are in the review process. Great. So these are the attributes again that we take a look at, and like I say, they're mapped all through the process. So at one point or another, all of these are reviewed. Okay, so next we'll talk about our admissions process. We don't have rolling admissions. We have admissions at one time of year, and it's actually quite condensed because you need to make sure that your application is in. We'll start out with when our application opens. And in fact, Shireen, if you want to talk through this process, that would be really great.
Sure. So this cycle opens on the last Thursday in April, which is April 24th of this year. And that is the window of opportunity if you've been working on your CASPA application to submit your application. Please bear in mind that our cycle has been shortened tremendously. So if you have applied in previous cycles outside of the 24-25 cycle, you will see that it's only a few months. So April 24th, the cycle opens. You can start submitting your application. The deadline is August 1st. That's our submission deadline. It's a hard deadline, so there is no exceptions to that. You want to make sure by 11:59 p.m. Eastern Standard Time that your application has been submitted through the CAS system. There is no supplemental application fee that applicants have to pay. It's just your CASPA application fee. Between August 1st and August 15th, the CAS team will be reviewing and verifying your application, making sure that if you are one of those individuals that waited until August 1st, that's the opportunity for them to go through and confirm your transcripts have arrived. All of your additional supplemental information has also been submitted correctly. And then that's where the program, we begin our work through the entire month of August. We do aim to have in-person interviews in September. So notifications usually go out about the third week in August, and it will be through email. You will receive an email at the email address that you use with your CASPA application. Please remember that. So if you created a new email address just for PA school, you want to check that email address that you use, not a personal email address. Once you receive that email inviting you to interview with the program, then further instructions will be included on how you can sign up for one of the designated days, which will occur on our campus in Flint, Michigan. We do not offer virtual interviews. They will be in person. You will be expected to be here for approximately 4 hours. Please keep that in mind. The time slots for interviews are on a first come, first served basis. There's no preferential treatment. And if there is additional slots or there may be some cancellations, we may be able to accommodate, and you can work with me and the admissions team one-on-one, but it's a first come, first serve process. So you arrive on campus sometime in September. We should have those dates and we'll be sharing those pretty soon. Sometime in September, you will interview with us. It's a 4 hours, as Professor and Dr. Gilkey indicated. And then we also go back to the drawing board and start making decisions. From there, third week in October, that's when we start making phone calls at that time to notify those individuals they have been offered a seat in the program. Orientation typically will occur in November. it's within the first 2 weeks, I believe, Dr. Gilkey, and she can correct me if it changes, but November, you're expected to be on campus for a full day of orientation, and then we will have you on campus the 1st of January for the class of 2028. Any questions before we move on, or Dr. Gilkey?
No, no, that's great.
I do have a question, if you don't mind.
Yes, sure.
So when you were talking about the admissions process and the reevaluation of the last 60 credit hours, you had mentioned something about it just being your bachelor's degree. If somebody has a graduate degree and they've completed another 60 hours, would you evaluate that 60 hours, or would you still use the bachelor's degree 60 hours?
Yeah, it's a degree that's used because we compare students and like students, although we don't discount the fact that you have a master's degree. I mean, that's really a wonderful thing. And in our holistic admissions process, we look at that. But when we compare undergraduate, that's what we look at.
Perfect. I appreciate it.
Yeah.
I also had another question.
Mhm.
So you were talking about how if you go to U of M-Flint, you're already automatically guaranteed an interview. I was wondering if they would consider your application or like not give you an automatic interview if you went to community college first and then transferred to U of M-Flint.
Oh, that's a good question. No, if you graduated from U of M-Flint, doesn't matter where you started. If you're a graduate of U of M-Flint, then in those areas you have automatic and you meet the minimum requirement. Yeah.
Okay, thank you.
Sure.
Hi, I have a question as well. Uh, you may touch upon this topic, but I'm not exactly sure if it's coming or not, and if so, I can defer until that time. When working on your CASPA and also trying to get your patient contact hours, is there a time frame that it needs to be done, or it has to be done by the time you start registering all of your information into the CASPA system?
So I'm sorry. So are you talking about your hands-on healthcare experience?
Yes, I
Yeah.
think a lot of schools call it patient contact hour, so I just thought it was
Sure.
the same.
Oh, sure. Yeah. Just want to make sure we're talking about the same thing. So those have to be in the at least in the 2 years. I mean, many people have many years of experience, but we want you to have current experience. So you need to have at least 500 hours within the 2 years prior to submission of your application.
Okay, so have them completed before I started completing the CASPA.
They could be simultaneous,
Okay.
but by the time that you submit, you need to have 500 hours in the 2 years leading up
Okay.
to that.
Okay. And the second part of my question, and this may be on the website, do you have a specific type of, because I know some schools don't consider shadowing to be within those hours. They want you to work. So I'm not sure if that applies with U of M, meaning
That's
a
true.
paid
Yes.
job.
A paid job. Yeah. We do differentiate. Shadowing is not considered hands-on healthcare experience for us. It's very valuable to do that, but that's not part of the hands-on healthcare. And there's a place in the CASPA application for both of those.
Okay, thank you.
Yeah.
Hi, I just had a question regarding when you said that the students that attend U of M-Flint are guaranteed an interview. Does the same apply for students that go to other U of M campuses?
Oh, so you're talking like U of M Dearborn or Ann Arbor?
Yes.
We have not been granting automatic interviews for that. Unless, Shireen, I'm wrong, but I don't believe that we have.
No, you're absolutely correct.
Yeah, it's just U of M-Flint.
Okay, Shaylin, do you want to hold on for a moment or your question?
If we need to move on, I can wait. But I think I had a similar question to what everybody was asking about being a graduate from other U of M campuses, if there's any preference, but I also wanted to ask a question about admissions preferences. Is that okay?
Sure.
Okay. I was wondering if there are any special admission considerations in the holistic review of applicants for like first gen students. or students with no like family history of medical background and no history of higher education?
You know, that's a really good question. And no, we don't have those preferences at all. The only preferences that we have are the ones if you're a U of M-Flint student in those certain areas. But otherwise, the attributes that we look at, those are simply the ones that we look at and consider. Okay.
Okay, thank you.
Mhm. That being said, though, I want to let you know, though, that you know, we do have a considerable number of students who are first gen and come from families that have no background in that. So I just want to let you know, you're if not that you, but if anyone was in that situation, that you would not be alone. Let me just say that. The PA profession itself, you know, I have to tell you, over all the years, is really a wonderful profession for many people who come from backgrounds where there are no medical professionals and are first gen. So it's really good. Okay. And Tareen, you want to talk about these verification dates and things too?
Yes, sure. I just also submitted, I'm sorry, I just also uploaded to the chat a link to the Google form, so which is for our 7-year prerequisite science course waiver and also our last 60 undergrad credit hours waiver as well. But again, our CASPA verification deadline is Friday, August 15th. So the hard deadline to submit your application is August 1st. That deadline for the verification is the 15th, so it's very short. It's, you know, if you find that you wanted to submit one more document, you have that window. That's your window. The Casper, again, we do require that. Testing dates will open up shortly. The last day is Thursday, July 31st. There are 2 sessions at that time. I believe there are 4 p.m. The first one will be 4 p.m. and the second is 8 p.m. So there's no exceptions to that because the the team needs 2 weeks to review and assign your scores. So you have to make sure that you select one of those dates. We recommend that you try to sit for that Casper test as soon as possible. Do not wait for the last day, just in case your system shuts down, the power goes, all of those things that are out of your control that can happen. So keep that in mind as you set yourself up to begin making preparation with your application and everything else. Then the Casper score is only valid for 1 admission cycle. So again, if you applied last cycle to a number of schools and you're throwing your hands in the pot again to apply, we cannot use the Casper score from last year. You have to sit a new test. And our science prereq courses, human anatomy, it's all the science, of course, human physiology, chemistry, and the microbiology must be completed within 7 years from the date of application. Additional information can be found on our website. If you have any questions about it, you can also send me an email, which we'll share at the end of the session. Okay. And I believe Dr. Gill, you shared this, but if you
Yes.
would like.
Sure. So let's talk about some other admission requirements, just so that you know. So you have to have a bachelor's degree from the U.S. or a regionally accredited institution. So that's really important. So if you have your undergraduate degree from another from a non-U.S. Institution, then it's going to be really important that you at least get your prerequisites in the US. So that's really important to us. Also, if you have a non-US degree, there may be a translation of your transcript that is required. So it's really important that you submit it for the translated so that we can have that transcript. We don't grant transfer requests from students from other PA programs. If you're a PA student in a different program and you decide, would like to come to U of M, then you're going to have to apply through the regular process. And there's many reasons why a student would stop being in a certain program and want to join us for many reasons, but you would still need to come through the regular CASPA application and regular application process. So we're often asked, I took some courses online and I also have classes in person. Do you accept the online courses? And yes, we do. We do accept online courses. And we don't have a standardized test for medical knowledge that you need. So the GRE, the PA CAT, none of those exams are required. I do want to tell you though, we have, we started that just this first year, is once our students were accepted this year, we asked that they go through the PA CAT modules and that they actually take the PA CAT for us at our expense. This was just so that we would have an idea of where you're at and being able to sort of compare. But again, that would be something that we would request and we would take care of as well. So it's, again, for us to be able to help you and know where you're at when we get started. So just so you know. Okay. So as you know, we talked about the prerequisite coursework and having a minimum GPA of 3.0 or greater. We also said that you need to have a C or greater in the prerequisite courses. And I think we're on a different slide. I think somehow it got moved. And thank you. And then the pass, no pass grade option. We don't accept that. We need a grade. So if you happen to take a class and you have a pass, no pass, sometimes you can go back if the instructor is still there and they'll write you a letter and be able to say what your actual letter grade is. So just know that that is an option. And if that's the case, then please email us and we can sort of talk you through that. We don't accept advanced placement credits. We need an actual course grade. And again, it's so that we can compare all students equally. And then as someone had asked earlier about graduate level coursework, no, that doesn't fulfill our prerequisite requirements. And, you know, a really nice thing, some students have, what they did was, you know, they didn't do the best in their sciences as an undergrad, so they went ahead and they got a post-bac or a graduate degree in science, in biological sciences. And that's really a very good thing. Even though we can't use those for your GPA or prerequisites, we know that you've gotten that, and that's a really good thing. So just know that that is an option as well. Okay, moving on. So prerequisite coursework. So we have these prerequisite courses that you need to take. So anatomy, and this is all on our website too, and there is a section where you can go and check your courses that you have taken and see if they fulfill these prerequisites requirements. So human anatomy, basically we need one lecture course, okay? And it must cover all the body systems. And the level of the course we have where you can actually go in and type in course that you took and hopefully it would come up. If there's any questions, you can always email us if it doesn't appear in that at that site, and we will look it up and give you an idea. We also, if you have the syllabus, that's very helpful as well, and we can take a look at that. The whole idea is that you need to have a good background before you come in because you have to hit the ground running here. So that's, you know, that's really important. So human physiology, you have to have 2 courses. And one course can be a 1,000 or 2,000 level, but you also have to have a 3,000 level or higher human physiology course. And those are more specialized courses such as exercise physiology or genetics or immunology or pathophysiology. I happen to really like pathophysiology. I think that's a really great prep course, but That's not offered everywhere, and depending on your undergraduate course of study, it may not fit into that, but I think that's a really good one. Then you need to have 2 chemistry courses, and that's 2 lecture courses. And one must be an organic chemistry or a biochemistry, just so you know. Okay, so 2 courses, and at least one of them must be an organic chemistry or biochem. Moving on to microbiology, and this is the only one of the prerequisites where you actually have to have a lab. So the microbiology is 1 lecture course and 1 lab course, and very often they're tied together. And it can be an online course, so just so that you know. And then moving on to developmental psychology, 1 lecture course, and it's really important that you take a course that spans the lifespan. So we're talking from infancy to older adult, okay? And to death. That is really important. So a general psychology generally doesn't do it. Usually they have in the description either the title that it's a lifespan or in the description of it. And if you have any questions and you haven't taken the course, but you need to choose one, you can contact us and we can let you know, if which one might be really able to fit our prerequisites. Okay, so it's the lifespan psychology, developmental. Then statistics. You have to have 1 lecture course, and an introductory statistics really is fine. We just want to make sure that you have the basics on that. And then medical terminology. Again, can't wait to come into our program and not have at least a basic understanding of medical terminology. Very often you pick it up in your clinical work, but it's really something where you have to have 1 course. Okay. Okay, so healthcare experience, minimum of 500 hours of direct hands-on healthcare experience. Paid experience is preferred, but if relevant volunteer experience may be considered as well. Supervisor verification is important, so make sure to have 1 letter of recommendation from a supervisor that can confirm your patient care hours is required. Okay. And then check with the PA program website for acceptable healthcare, hands-on healthcare experiences. And there's a whole list of experiences. And again, if you have any questions about that, just shoot us an email and we'll get back to you on that. Okay, so the interview process, already talked about that, the whole 5-step process that your application goes through. And it's really important when you come that that you come and plan to spend some time with us. So it's not only the interview process and the writing prompt and asking the questions, but you actually get a campus tour, so you can actually see our cadaver lab, and you can see where housing is, you can see where the library is. We have actually a lovely campus, so if you're not familiar with it, it's walkable and manageable, and it's really very pretty. So again, we'll take a writing sample, and there will be campus community presentations as well, so that you'll know what's going on our campus. So that it should give you a very good taste of what it would be like to be on our campus. Okay, and Shireen already mentioned to you the days. So there is on-campus housing available for graduate students, and if you have a long commute, we really suggest you consider staying on campus or near. We do have apartment style suites as well that accommodate up to 5 students. It's super convenient to live on campus, and when we have weather like this, it's perfect. So you don't have to worry about the commute. There's free parking with secure building access. There's all kinds of amenities here: computer lab, print station, study rooms. You get a chance to be sort of in a living, learning community of like-minded students, so you can study together and can use the classrooms where the riverfront is and be able to study there at all different times and work in groups there. It's really wonderful. They also have 24/7 services there. So I highly suggest this if you can swing that, because it's really a wonderful thing to be able to have the convenience and then have like-minded folks around. Okay, so residency guidelines. So out-of-state students must file an application for resident classification, as was told to you. International students must obtain an I-20 visa to enroll. And a criminal background check is done on all students prior. And we also do drug screening prior. And the drug screen must come back clean. And we'll talk more about that at the time of the interview. But drug screening is very important. And you just must know if there are medications that you're taking that are prescribed for you. However, there is an issue with marijuana, and our clinical sites, because they receive federal funding, cannot have a positive screen for marijuana. So just so you know, okay? That's it. Okay, so admitted student data. Going to go through this quickly. This gives you an idea of the different students. Our cumulative GPA has gone up over time, and as well as our prerequisite GPA, but don't let that scare you. I mean, there's always a range of GPAs. These are just averages, but you know, there truly is a range of GPAs. Some are higher, some are lower. These are just averages. So our average age has also gotten younger. So our average age of our class of 27 is 23, which is quite young. But again, we have a range of individuals. And so average patient care experience is 2,321 hours. We have people that come in with 500 hours, and we have people that come in with many more years of experience. So currently we have 46 females and 4 males in our class. We've had various mixes in the past as well. Okay, so we have some QR codes here for you regarding our waiver request, or and certainly one that would lead you to our PA website. A recording of this session is going to be on our website, just so that you know, okay? And you'll be able to refer back to it if you have any questions about our admissions process, how you're evaluated, the things that are important to you to know all about our PA process and our program. Okay, and so here's, if you will take the program survey, we would very much appreciate it. Our telephone number is here. Any questions regarding our admissions process and those things that are very specific to you, please feel free to reach out to flint.padept@umich.edu. That is our admissions email. And so especially you will want documentation of that. So that is something that's very important to note that, okay? All right. So are we ready for questions?
I have a question.
Yes.
Hi. Well, first and foremost, thank you so much for that informative session. I did have a question in regards of the patient care hours. Do you guys have some? So I saw the list on the website. Do you have any? Do you prefer more of like medical care or just direct patient care?
So how do you differentiate between? Can you give me some examples, Sarah, of what you mean of that? So,
Yeah, of course. So
Okay.
I currently work as a community health worker, and that lies more towards the mental health department. But I do work hands in hand with the psychiatrist. So would that be okay?
It might be. What I suggest in that situation is I suggest you email us and give us a complete list of what you do. And then we can take a look at that and see how that compares to what our requirements are. Okay. Because I would feel uncomfortable saying, oh, yeah, sure. And we have had a number of individuals who have worked in psych. But I feel uncomfortable doing that without actually seeing the list of duties. So please send us an email about that. Okay.
I will. Thank you.
Great.
Okay.
Thanks.
Okay, Andrew, you have your hand raised for a while. Go ahead.
Yes, just a question on the prerequisites required. I took my Anatomy and Physiology 1 in 2017, starting my paramedic program, and then took Anatomy and Physiology 2 in 2019 to finish it out. Does that mean I'm gonna be right at that 7-year mark with the first Anatomy and Physiology? Do I need to retake that, or would I still be grandfathered in as that being a dual enrollment class, or a dual class, I should say?
Yeah, and that would be something that you would email us about. And you may, depending on how it falls, you may have to ask for a 7-year waiver on that.
Okay,
Okay.
understood.
And when you do a 7-year waiver, what we look at in determining whether that is meets our requirements is, have you actually used the things that in your work that are the instructional objectives and the goals of the course? Have you been using that content in your actual work? So, if anatomy and physiology, have you actually been, do you have a job that requires you to have knowledge of those areas? So that's how we look at that. Okay.
Understood. Thank you.
Okay, sure.
I also had 2 more questions to ask.
Okay.
So the first is, if the GRE is taken, would it be like taken into consideration into your application if you submitted it?
No, we don't consider that in our application process.
Okay.
It's
And
not a bad thing, but no, we don't take that into consideration. That's not one of our things.
okay. And then the other question I had is, what's the Casper test and what does it consist of?
Oh, the Casper test is one that tests what is considered non-cognitive factors. So those are things like communication and empathy. And so there's a series of scenarios that you're shown, and you have to respond, and then you're rated on those things. And then how well maybe you communicated with your patient and how much empathy you showed, and the just various things that you're scored on. And it may be looked at by 1 or 2 people. And then you're given a score for each one of your scenarios, and then they come up with an overall score. And I believe that they compare your progress on all others that took it in that period of time. And then we're given a score. And that gives us some idea about like I said, sort of those soft skills. So it's something that we can take a look at. But like I said, we don't have a cut score for it. We look to see the higher the score, apparently the better, but we're in the process actually of taking a look at that and seeing what those Casper scores are. Do they really correlate to how a student progresses in the program and their professionalism and those other things? Because when you're in a PA program, and I would say probably every single PA program looks at this, we not only look at your academic progress, but we look at your professional progress too. You have to have both. So that's the reason why on the admission end, we look at both of those things.
All right. Thank you so much.
Sure, you're welcome.
Hi, I have a quick question, or actually 2 questions.
Okay.
So you mentioned you don't count AP credits. Would that be the same for IB credits too?
IB credits. Shireen, this is for you.
Yes, so we do not count IB credits. It has to be a letter grade. If you are able to work with the professor in giving providing a documentation with the grade that would have been awarded, then yes.
Okay, thank you. And then one more question. if you need to take prerequisites, would you count like for the coming fall semester, so fall 2025, if you're applying this coming cycle?
No, your prerequisites must all be completed by the time that you submit your application.
Okay.
But you can still be working on your degree as long as you graduate by December, but you must have all of your prerequisites done by that date so that, again, we can compare each student so that everyone has completed those things.
All right, gotcha. Thank you.
You're welcome.
Hello. Quick question.
Sure.
Hi.
It's Matthew?
Yes, hi.
Hi.
I have like several degrees in behavioral science and psychology and neuroscience. So my psychology classes aren't necessarily, I don't think I ever took one single lifespan course or psychology over a lifespan, but I did take adolescent psychology. I did take psychology for, children, psychology, so on and so forth for different areas. But combined they would, of course, do a lifespan. Would that count?
We would need to look at that on an individual basis, and with the final end point, making sure that all of that has been covered. But we would need to take a look. I suggest you email us on that one.
Perhaps provide course descriptions.
Yeah, you would send the course name, the number of credits where you took it at, and also a syllabus if you have that.
Sure. Okay, thank you very much.
Sure.
Okay, Shaylin, you have another question?
Yeah, hi. I had an accreditation question. One thing, so the probation status, I'm not even gonna lie, it does worry me a little bit applying to this program and putting resources into applying. It's already restricted. And I was just wondering, I've heard like we've made changes and we've taken these measures, but I was wondering what those measures are specifically and how you feel as the program director, Dr. Gilkey, how they're going to change your status this go around next month.
I'm going to be very straight with you. I can't predict what ARC-PA is going to do. I would never suppose to do that, but I can tell you what we have done. And so there were some areas of concern, and we have worked, oh my gosh, diligently with over the last 2 years in making sure that our self-assessment process is very solid. And what that means is that we have a very thorough self-assessment process, and that is really important. So everything gets assessed from our admissions process all the way through graduation, and looking at our PANCE scores. PANCE is our certification examination, which many programs are looking at, and we're compared against, and looking to see how we did according to the national average. So looking at a program self-assessment process and basically how well we manage that is really important. So that's one area that we have spent a tremendous amount of time. We've hired new faculty and staff to be able to help with that and going forward. So that's one area. Institutional support, when we look at that, we've hired a new faculty, and we're in the process of looking at hiring another faculty to be able to help us with our program. And like I said, hiring staff to be able to help us with this whole self-assessment process. And then again, working on sort of the infrastructure. And I know that in terms of syllabi, particularly in our clinical year, and working on getting that together. So we have 2 clinical coordinators who have been working very hard, and we've been able to supplement our clinical team. So we're expanding our clinical team to be able to help with that as well. Because our clinical phase in particular is very, very important to us. That is our outward facing and part, and that is very, very important. So in fact, I think she's here, Professor Guerin, who is one of our clinical coordinators, and she's also the admissions chair. She is on today, and that is one area that we've put a lot of resources and time into as well. So those are the things that we have been doing, as well as, you know, maintaining very good didactic phase and you know, making sure that we've increased our first-time pass rate on PANCE. That's a very long answer, but it's been, you know, really a process for us. So, and so I'm telling you as honestly as I can and transparently.
I totally understand that, and I appreciate your answer. I took some notes here as you were speaking, and I do just want to say that your outward-facing presentation, from what I've heard, is going well. I have a very good friend who goes to
Great.
medical school at the University of Michigan, and she's encouraged me to apply to the UM-Flint PA program this cycle because of what she's seen in her clinical rotations with the PA students who come from your program. And she says that the students who come and represent you guys, they know what they're talking about, they know their stuff. They walk in with confidence and poise. And so that is one of the reasons that I actually attended this webinar, is because I wanted to get a better feel for what you guys are doing. So
yeah. Well, thank you very much
keep
for
up the
that
good work.
feedback.
Yes.
Yeah, that's really wonderful. And like I said, we have wonderful faculty and staff who work very, very hard on our students' behalf. And then, of course, our students are, I think they're wonderful as well. So it's a lot of different components that make up a good program or a great program. We're still new, but we have developed and grown tremendously within the past years, and we've had a lot of stability as well in terms of our faculty. And I'm, like I said, as program director, I'm so grateful for that. So that's good. Thank you, though, for that feedback. Appreciate that.
Okay, we're at 20 minutes past the 1 hour mark of 1 hour for the webinars. And we know a lot of you have taken time out of your busy schedules and work schedules to attend. So we appreciate your attendance very much. Once again, just a quick recap. If you have any questions regarding course equivalency, feel free to email the email address that you see on the screen. Provide as much information if you have your transcript, the course syllabi, anything, include those so that we can take a look at those and confirm with you. And also the cycle opens on April 24th. So you have some time to work on your application. It does take some time. So I do recommend that you start, you create an account in the CAS system now. It should be available, I believe, at the end of this month, if I'm not mistaken, if it's not already available. And go ahead and start looking through to start pulling together all of the documentation that you need, making sure that you're reaching out to individuals who will be providing you with letters of recommendations and all that good stuff. It's not an application you can complete in a few hours. So I recommend to get started as early as you possibly can. And that is all. If we have no more questions, we will say good night and all the best.
Yes, thank you so much, everyone. Hope to see you.
Thank you,
Thanks,
Professor Gilkey
guys.
and Shireen. Appreciate your time.
Thank you, guys.
Bye.
Very welcome. Bye, everyone.